There are times when we can have a feeling of sadness, of anxiety, and we have negative thoughts for the most of the time. It is not a pleasant feeling, but rest assured, this phenomenon, called depression, can depend on various factors, not necessarily serious. Let's find out together with today's video. Hello and welcome back in Med4Care. Today's topic is depression. What do we mean when we talk about depression? It is a mental disorder characterized by an always depressed mood, loss of interest or pleasure in activities that normally were welcome, and by both physical and cognitive changes. How can we recognize this feeling? Symptoms may include feelings of sadness, anxiety, energy loss, difficulty concentrating, increase or weight loss, and sleep problems. There are negative thoughts or even suicidal ideas. Depression is a serious pathology that can have negative consequences on our life, on relationships with others, and at work. It is good to know that it is one of the most common mental pathologies worldwide. According to estimates of the World Health Organization, about 4.4% of the world population suffers from major depression. This is the most common form of depression and differs from the smaller depression, which is lighter. It is a highly recurrent condition. What does it mean? It means that, according to some estimates, more than half of the people who have had an episode of greater depression will develop another in the future. But what are the causes? It is difficult to attribute depression to a single cause. Furthermore, even if an event can trigger an episode of depression, it does not mean that it is its only cause. Let's see together which are the most common factors. We have biological factors. In fact, depression can be linked to central nervous system problems. For example, we can suffer from a lack of some neurotransmitters such as serotonin or norepinephrine. Hypothyroidism can also cause depression. There are also environmental factors. Some stressful events such as the loss of a job, a sentimental break, the death of a loved one, or a traumatic event can trigger an episode of depression. Living in conditions of poverty, in a violent environment, or in an area with poor social services can increase the risk of developing this disease. Finally, we have psychological factors. Some people have low self-esteem and see events in a negative way. Each pathology has its symptoms, and depression is certainly not exception. These symptoms may vary from person to person, but the most common are blue mood, feelings of sadness, despair, emptiness, or sense of uselessness. Loss of interest or pleasure in normally welcome activities. There is no longer an interest in hobbies, sports, social activities, and relationships. Sleep changes, difficulty falling asleep, waking up early in the morning, or sleeping too much. Weight changes, increase or weight loss, even without a change in nutrition or physical exercise. Anxiety or agitation, feeling in panic, having obsessive thoughts, or feeling restless. Difficulty concentration or make decisions. Tiredness or lack of energy, feel exhausted or without energy, even without an apparent reason. Feelings of guilt or uselessness. Suicidal thoughts, to have thoughts of death or suicide, or plan suicide. As you can see, these symptoms are many, and it is easy to have worn them at least once. Does this mean that we suffer from depression? No! It is important to specify that, to diagnose depression, the symptoms must be present for at least 2 weeks and have a significant impact on daily life. These symptoms are present in major depression but also in other diseases, including bipolar disorder, a disease characterized by great mood changes. Generalized anxiety disorder and panic disorder that involve depressed mood and loss of interest or pleasure. Postpartum depression, a form of depression that affects women after childbirth. The seasonal depression, which arrives during the winter and connects to the reduction of sunlight. Post-traumatic stress disorder, which presents depressive symptoms. Well, we saw the causes and symptoms together, but what can we do in the event of depression? Take a broom and hide everything under the carpet? Will you sleep on it so much will everything pass? No! It is vital to speak immediately with a doctor or a psychologist/psychiatrist. They can diagnose depression and prescribe antidepressant drugs or recommend psychological therapy. In addition, participating in a therapy can help understand and manage the thoughts, emotions, and behavior associated with depression. Regular physical activity improves mood and reduces stress. Good nutrition helps to maintain the balance of body and brain functions. It is vital to avoid the use of drugs and alcohol abuse because they can worsen the symptoms of depression. As you can see, there are many remedies that can help us. First of all, however, you need a reliable diagnosis. Can our hairdresser do it? That colleague who knows all the answers? Better not. The diagnosis of depression can be assessed by a psychiatry or a psychologist. They are responsible for specific medical or psychological therapy. The diagnostic suspicion can also be evaluated by a general practitioner. The evaluation of the psychiatrist allows you to examine our symptoms and our medical and family history. A specialist evaluation for depression may include several steps. The interview. The professional uses a series of questions to determine the patient's symptoms. Do you feel sad or depressed for most of the day, almost every day? The activities that you liked once seemed less interesting lately? Have there been significant changes in weight or appetite? Do you have difficulty sleeping, or are you tired and without energy for most of the day? Is it difficult to focus or make decisions? Do you feel guilty or useless for most of the day, almost every day? Do you have thoughts of death or suicide? It is possible that we are asked for information on our medical history, the family history of mental illnesses, and the use of drugs or alcohol. In addition to the interview, the professional uses the depression evaluation scales. These serve to quantify the symptoms of depression. The most common are the scale of Beck's depression and the Hamilton scale. Then we have the self-assessment scale of Zung's depression. It is a self-administered questionnaire with 20 questions. And finally, the Patient's Health Questionnaire 9, this self-administered and consisting of 9 questions also. It is often used in combination with the clinical interview for a more complete evaluation. Be careful. It is important, once the evaluation scale is chosen, to always continue with it in order to maintain a single reference to consider the effectiveness of the therapy. Another tool used by the professional in the diagnosis is given by the blood tests. They serve to exclude organic causes, such as the lack of vitamins or minerals, thyroid pathologies, or operating problems of the liver and kidneys. They are useful for evaluating hormonal function and to verify the presence of toxic substances or drugs in the blood, since these can affect mood and cause depressive symptoms. Once the diagnosis is done, everything is ready to start the most appropriate treatment. There are different ways. We have cognitive behavioral therapy. It serves to identify and modify the negative emotions and behaviors associated with depression. During the sessions, the therapist will help us become aware of our thoughts and emotions, then teach us the techniques to change the negative predispositions. It could require us the execution of some tasks between one session and another, such as keeping an updated diary of your thoughts, or carry out activities that we usually avoid precisely because of depression. Another remedy may be interpersonal therapy. This therapy focuses on relational problems and interpersonal difficulties. During the sessions, the therapist will in fact help us identify and understand precisely those problems that we encounter in relationships and relationships with others. The professional can also teach us new interpersonal skills to better manage our social life. The therapies we have seen can be used by sunshine or in combination with other treatments. We therefore come to pharmacological remedies. The drugs used to treat depression are called antidepressants. There are different types, including selective inhibitors that act by increasing the levels of serotonin, a neurotransmitter that can affect the mood tone. These drugs are SP. It is the first choice of treatment for depression since they have less side effects than others. The inhibitors of serotonin and norepinephrine, which increase the levels of both neurotransmitters. Other inhibitors that increase the levels of different neurotransmitters, including serotonin, norepinephrine, and dopamine. Tricyclic antidepressants, which are more dated drugs and have more side effects than others. For this reason, they are used less frequently. Antidepressant drugs are prescribed by the doctor or psychiatrist and can be taken for several weeks or months to achieve the results. In addition, the effect can vary from person to person. It is vital to follow the doctor's instructions and do not interrupt treatment without his advice, since otherwise a rebound effect may occur. Do you know what it is? If we stop taking drugs arbitrarily, the disease will knock on our door again. In addition, 2 to 3 weeks often need to start seeing the first benefits. Therefore, it is important to continue the therapy for at least 20 days before considering it possibly ineffective. One last way to go is electroshock. A brain-controlled electric discharge is applied to produce a convulsion. This procedure is performed under general anesthesia and lasts only a few minutes. Now, some important clarifications. Electroshock is considered a safe and effective treatment for major depression, but is reserved for selected cases and must only be performed by qualified professionals. It is used only in case of failure of previous treatments, because it could induce some side effects such as loss of short-term memory. In addition to the main therapies, there are different alternative therapies that we can use to treat depression, including meditation, mindfulness in particular, yoga, acupuncture, phytotherapy, a therapeutic remedy that is based on the use of medicinal plants. Attention! These alternative therapies are not a substitute for traditional medical treatment and must be used only as a complement and always under the supervision of a doctor or psychologist. Food can also have a significant impact on the mood and symptoms of depression. Do you want any nutritional advice? Very good! Refined sugars and carbohydrates, consume foods rich in omega-3 are limited, drink a lot of water. It is important to limit the consumption of alcohol and caffeine. Eat foods rich in vitamins of group B and don't forget fresh fruit. Even lean proteins such as chicken, fish, and legumes maintain stable blood sugar levels and therefore contribute to the stabilization of mood. Finally, integrate the diet with probiotics. They are beneficial bacteria for the intestine, important for the health of the nervous system. We're now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like, subscribe to the channel, and click on the bell to be notified every time our new video comes out. See you soon on Med4Care.